Okay, I've included these pages just for practice. And so what I have here is, again, is atrial, double humped and squiggly, ventricular, tall and goes to the bottom. This one isn't a really good example because it doesn't go all the way to the bottom, but it should. And then the arterial, which is triangular with the dicrotic notch. And so again, and these aren't on a scale, so it's impossible to know what these are. We don't know if it's the right or left side. So again, I just wanted to list them here, all three kind of together, just to demonstrate the three in close proximity. Okay, these I included for practice as well. So here we have double humped and squiggly, double humped and squiggly. And so these two are atrial, and so we need to know which atria. So this one, the scale isn't real good, but we can tell that this one's lower than this one. So this would be the right atria. This would be the left atrium. Okay, so here we have tall, and they go all the way to the bottom. Tall and go all the way to the bottom. So again, so both of these are ventricular, and so of course the bottom one would be the right ventricle. The top one is left ventricle, because remember your left ventricle is going to be like 120 and here's 100, so and it's going over that. So 120 is systolic, diastolic is 0, and then your EDP is like 10. The right ventricle, remember, is 25, so here's 50, so yeah, it's going about halfway. So 25 goes all the way to 0, and the EDP is about 5. Okay, and then here we've got the triangular, and it has the dicrotic notch, and it does not go all the way to 0, okay, because remember your normal arterial pressure, so first of all, this is arterial. A normal artery pressure is 120 over 80, and then this would be pulmonary. Remember, your pulmonary artery is about 25 over 10. So that's, again, just kind of for practice. You have a diagram already similar to this. Some of the numbers are not included on this. For instance, your systolic RV is going to be 25. Your systolic LV is going to be like 120. So just kind of keep that in mind, but that's just another picture of that. And then these numbers I kind of just put in here just to kind of make you think. So here we have a whole bunch of numbers, and at first it's overwhelming and you can't make heads or tails of them. But then if we look at them closely, we can figure this out. So first I'm going to go for this one first, because 120 and then systolic and then a diastolic of 0, so that's got to be left ventricle. And then same here, this one, just a process of elimination. I'm going to kind of go down these, and so that's 25 systolic and 0 diastolic, so that's got to be right ventricle. And then here we've got your normal artery is 120 over 80, so that's got to be aorta. And so your normal pulmonary artery is like 25 over 10, so that's got to be pulmonary artery. Okay, and then here, these are the ones that are a little bit harder, just because you don't normally see the atria systolic, diastolic. It's usually just the mean, so that has to be the right atrium. And then again, we don't really normally see the systolic, diastolic for the atrium, because it's all just kind of the same, but the mean is what we normally look at, and so it has to be left atrium. So again, I just wanted you to practice, looking at those numbers and just kind of, you know, dissecting it down and figuring out what number is what. Okay, and then these are some pictures that I included. This one's in your book. This is the right atrium, and again, just reminding you that the right atrium pressure increases during the P wave and the T wave. And this isn't a really good example, I don't think, but it's just showing you that um, the pressure does increase during the P wave, during atrial contraction, and then the pressure does increase here on the T wave, which is the heart at rest, the heart at diastole. So if you were to follow this, again, P wave, T wave, it's showing you this is the where the atrium pressure increases. Okay, here's another example of pressure of the atria rather. Here's the right atrium. Whoops, I hate it when it does that, or when I do that. It's my fault. Okay, so again, P wave, T wave, P wave, T wave. And this is the right atrium, left atrium. And again, you wouldn't know that unless there was a scale here. See, you can tell that this wave is less pressure than this one, and that's really the only way you can tell. You have to have them side by side, and it has to be on a scale before you can tell. But I just wanted to demonstrate again just another example of atrial pressure, so you get used to looking at it, I guess. Here is the right ventricle pressure. Again, this is from your book. I just copied it just to, it's demonstrating that on the upstroke, or I shouldn't say upstroke, on the R wave, the QRS complex here is where you're going to see peak systolic pressure. And remember, electrical events happen before mechanical events. I mean, it's a fraction of a second, but so sometimes you do have to, like here's your QRS complex, there's your peak systolic pressure. Here's your QRS complex, here's your peak systolic pressure. So just showing you. Also, the end diastolic pressure, remember, is right before the upslope. So this is your EDP right there, your end diastolic pressure. And then this is just another showing you the EKG strip and arterial pressure, triangular, and the CVP or right atrium pressure, double humped and squiggly. So just some examples of showing you these waveforms. Of course, this goes without saying, but make sure you understand that this is the electrical EKG, and these are your pressure waveforms within the chambers of the heart or blood vessels. There you go.